Plasma-derived therapies save my children's lives, literally. The first thing that would happen if we didn't have access to them would be that we would not be able to stop bleeding inside their bodies. They would first be in a lot of pain, then they would become crippled, and eventually they would die.
To think about having to go back long-term without my IGIV infusions, I would rather not be alive.
I think there's no question in my mind that I wouldn't be here right now if I wasn't on a plasma therapy. It's critically important that you understand that the cost of having a chronic condition like alpha-1 antitrypsin deficiency or hemophilia or a primary immune deficiency is much more significant if we didn't have access to therapy just to treat us. It's not only a matter of our lifespan, it's a matter of the cost and care of those that are affected.
A plasma protein-derived therapy has prolonged my life. When I was originally diagnosed with alpha-1 antitrypsin, I was 41 years old, and I was told I had 10 years to live. As you can see, I'm 58, so I've exceeded that time frame. So it's made a huge difference.
You know you're going to get sick if you don't have access to product. You have to do everything you can to avoid being exposed to illness, and your life change. You just fold up and you don't go out in the real world, if you will. You can't participate on a regular basis, whether it be a workplace or in school. And it's very restricting and quite frankly frightening.
I tell a story of a tale of two lives. I had my first life of sickness for 33 years. And at that point, at the low point of my physical existence where I thought I was going to die, I started to receive the plasma therapy. And within a couple months from being near death and certain that I would not be on the planet soon, I became very vital, full of energy. I no longer was sick. I joined a gym, I became fit. I actually became an aerobics instructor for 10 years.
Without those therapies, the children wouldn't be healthy. They would be in a great deal of pain a lot of the time. They would miss out on numerous daily activities. They wouldn't be able to attend school most likely. They would be crippled very quickly at a very young age, and their life expectancy would be approximately 9 years of age. So without plasma-derived therapies, yes, I can imagine that, and it would be terrible.
I don't fear death. I fear the long, slow spiral down to the sick life that I once had. That would be way worse than death. These are life-saving therapies for which there is no alternative for many, many patients. To take away the plasma therapy from a primary immune deficient such as myself, or the factor products from a hemophiliac, or any other patient group that depends on these products for which there is no alternative good therapy, what you're doing is you're condemning those people to a life of sickness and possibly death.
To you manufacturers that dedicate your lives to providing safe and efficacious therapies for those of us on plasma proteins, we can't thank you enough.
If I could say one thing to the manufacturers of plasma-derived therapies, it would be thank you, because their products save my children's lives.
The one thing I would say to a donor is thank you. Thank you for giving me and all the millions of patients the lives that we have.
Without your donation, we would not be able to pool the plasma in order to create the protein-enhanced plasma that I receive. I think my sons thank you. I know my husband does.